Well, wow. Thank you all so much for that wonderful going away present. I didn't really know about this. I appreciate this a great deal. It's been a wonderful thing for me to come here to Roanoke. I came in 2001, and it's been a great experience for Patsy and I. I've seen a lot of changes at Carilion, but the vast majority of them have been good. It's a bittersweet moment for me to retire, but I'll join some other people that have retired, as you can see up there, including Dr. Sisk and Dr. Myers and many others. So thank you for coming. I really do appreciate it. And let me get on with this talk. So how did I come up with a talk like this? It's not a typical pediatric talk, but Dr. Powell gave a talk earlier in the year about several health factors, including diet and exercise and things like that. And I wanted to give a general talk when I leave here. And I spent many hours talking to teenagers about cardiac risk factors, including exercise, and I'm a longtime subscriber to New England Journal and JACC, that's Journal of American College of Cardiology, where they have lots of articles occasionally about adults and cardiac risk factors and exercise and things like that. And of course, they have a lot of articles about coronary heart disease and stents and that I don't read, but they do have some interesting articles. And this is an interesting topic to me, and I hope it's an interesting topic to you, and it is my last talk. So I would say that this pertains to everyone in the audience, even those people who are young. You have parents, you have grandparents. This pertains to your pediatric patients also, because they'll grow up to be adults, and we want them to be as healthy as possible. I have no disclosures, so the outline of this, these are some of the things I'm going to be talking about. And I'm going to go through what some of these terms are. I'm going to talk about sedentary lifestyle, recommendations for the amount of activity, how these recommendations were derived, fairly unpediatric thing to talk about, all-cause mortality and activity. And can there be too much of a good thing? So I have some notes of levity throughout this talk, I hope. So when I was researching this talk, I came across this article that I think most people are not even aware of. This is the Physical Activity Guidelines for Americans, second edition, 2018. There was an earlier edition in 2008, and this had a huge scientific report that went along with this, about 500 pages, about 300 or 400 articles regarding exercise and not actually exercise, but actually activity. And I'll talk about that in a minute. But I did read a lot of this. I went through a lot of the studies, and I'll talk about some of those in just a minute. So this is from the article, and I think most people have heard in different publications about the recommendation for moderate intensive aerobic activity of at least 150 minutes a week. That's what has been recommended, and at least 2 days a week of muscle strengthening activity. This is for adults, okay? This particular article also had recommendations for children and teenagers, but I'm sticking with adults because nearly all the studies really have been with adults. And the target audience is people like you. I know many of you already meet these recommendations for activity, but This is also for healthcare professionals so that they are aware of this and be able to talk to their patients and families. So why do we need to promote physical activity? As you can read that, men are doing a little bit better than women over these past years, but still only about 25% of men reach the recommended leisure activities. Childhood obesity rates, as you well know, you see it in your clinic all the time, have tripled since the 1970s. And for someone who was in the military for a long time and retired from the military, that's pretty amazing to me that obesity disqualifies up to 1/3 of American youth, ages 17 to 24. And as you can see, teenagers are not meeting the guidelines either. So I have to define the intensity of exercise because this relates to moderate intensity or vigorous intensity. So sorry about the typos here. I transferred the slide directly from this talk to this talk here. So moderate intensity, the absolute scale is 3 to 5.9 METs. Now, I don't know if any of you know what METs are. Maybe you've seen it on your exercise equipment in the gym, but I'll explain to you what that is. And vigorous intensity exercise is on an absolute scale 6.0 or more METs. So that's what we're going to be talking about, moderate intensity and vigorous intensity activities, not exercise, activities. If I say the word exercise, people immediately think of gym or running or things like that. But we're talking more about activities. So what is a MET? A MET is it's a metabolic equivalent of task. 1 MET is the energy expenditure when you're sitting quietly as you are now, and it's your resting metabolic rate. And that is assigned as 1. It's actually equal to the oxygen you're consuming while you're sitting there, or the calories that you're burning. I can give you the numbers, but that's basically what it is. And I was amazed at this. Exercise physiologists have calculated METs for an enormous number of activities and tasks used in epidemiologic studies. And if you're really interested, there's a compendium of physical activities from 2011, which lists the METs for about 500 different activities, including mowing the lawn, gardening, all kinds of things. If it may not have occurred to you, but also sex, which that's about 1.8 METs. Don't ask me how they which is about the same METs as it is standing. So this is a list of moderate or vigorous activities. On the left is moderate activities. On the right is vigorous activities. Walking is over 3 miles per hour is actually considered a moderate activity. The METs for that is about 3.5. Recreation, you can read these here. So I think these are things that you would generally think would be, or you may not think that would be moderate. Some people would think that would be much less than that. But these are the general categories that are listed for moderate or vigorous activity. So this is one of my favorite characters, Winston Churchill. And by the way, he didn't pay attention to any of this stuff, and he lived to age 90. He drank to excess. He drank all day long. He was obese. He had poor sleeping habits. He smoked cigars. And he had opinions about many different things. He wasn't in that great a health, though. He did have 2 small heart attacks during World War II, which were kept fairly quiet. He had a major stroke when he was 78, and he actually died from a massive stroke when he was 90 years old. So this slide here is really the main take-home point from this talk, is that there have been lots of epidemiologic studies done, and this is the curves that they've generated for activity. And as you see along the vertical, it's a hazard ratio of mortality, and that is all-cause mortality. That's not just cardiovascular mortality. That's mainly cancer and cardiovascular disease, which accounts for about 80 to 85% of deaths in adults over the age of 40. And on the horizontal is your leisure time physical activity in MET hours per week. So as you can see, the important points are people up here who don't exercise at all. There's even some exercise, there's a marked improvement in your hazard ratio of early mortality. People who exercise more have a lower rate of early mortality. And this is where that recommendation of 150 to 300 minutes of vigorous activity, leisure activity per week came from. It actually came from mortality statistics. It wasn't some figure picked up out of the clear blue sky. And MET hours per week. For example, if you walked at a brisk pace for an hour, that would be 3.5 METs per hour, so that's 3.5 MET hours. So that's how that's calculated. So, any questions about this diagram? So you would wonder, how in the world do they come up with things like this? Well, this is where I get a little bit out of my league, because these are a lot of epidemiologic studies. The people who are expert in this are exercise physiologists, epidemiologists, public health experts, some cardiologists. But there have been studies done on activity and exercise and cardiovascular mortality and all-cause mortality for 40 or 50 years. And there's just a vast body of knowledge out there regarding this. So these studies, I would have to say right off the bat, there is no prospective double-blind study regarding the prevention of cardiovascular disease, cancer, or improvement in longevity. These are all observational studies. There is no proven cause and effect. However, I would say the same is true of smoking. There is no double-blind controlled studies showing that smoking causes heart disease and cancer. There's also no double-blind studies for climate change either. But most studies, there's a prospective cohort with one estimate of activity. In other words, most of these take a group of people. Most of the studies use a questionnaire. And these are pretty detailed questionnaires. They get the activity levels of these people. They follow them over a long period of time. These people, in general, are healthy people when they are first picked for these studies, and then, but there are problems with these studies, as you can see, because there's one questionnaire. A few of the studies have done one questionnaire of activity levels at the beginning and then tried to do another one somewhere along the line. But that's rare for these types of studies. Some of these studies now that they're getting step counters and accelerometers are going to be much more precise than the studies that I'm going to detail here. Most of these are both genders. Most are U.S. and European. There are some others from Taiwan, Australia, many other countries, but most are U.S. and European. And most of these are all-cause mortality, mainly cardiovascular disease and cancer. So I'm going to start going through a couple of these studies. I'm just going to talk about a few of them. Don't get your eyes glazed over yet. There's a few numbers here. So the first thing I wanted to talk about was sedentary activity. This is a big deal now. It's been studied a lot in the past 10 to 12 years. This is related to the people who, this is related to the standing up and standing desks, walking, treadmill walking, things like that. Because there have been a lot of studies that show that sedentary activity, apart from your exercise activities, is related to early mortality. And this is from the slide from that scientific talk. And of course, the people who sit the most and exercise the least have the highest chance of mortality. Just sitting less, you improve your chances of early mortality. People who exercise a lot are in the green, even if they tend to sit a lot. So I'm going to discuss one article about this the article that's talked about most of the studies that I've read. So this is an article from Lancet in 2016. It's a meta-analysis with 16 studies. About 1 million people followed from 2 to 18 years. And what they did was they calculated the sitting time per day and the activity levels of these patients, of these people, not patients. And some of these studies also had data on TV viewing time, but I'm not going to discuss that. But this is the relationship between sitting and all-cause mortality, stratified by amount of moderate to vigorous activity. So this is the referent group here. These are the people who exercise the most and sat the least. The people who are, have the greatest chance of early mortality, and the risk of early mortality in this category of people is about 58% increased risk. These are people who exercise very little and sit a lot. And if you look at these hours per day of sitting, do you have any idea what the hours per day of sitting are for the regular U.S. population? It's actually 7.7 hours. Most people have sedentary jobs. So 7.7 hours is the average time of sitting for most U.S. adults. But as you can see, as you sit less, your hazard ratio of mortality comes down. For all of these exercise categories. Now, 16 MET hours per week, the recommended vigorous activity recommendations are 150 to 300 minutes per week of leisure time activity. That's about 8 to 16 MET hours per week. So 16 MET hours per week is about 300 minutes of moderate exercise per week. And even at that pretty high level, you have increased risk of earlier mortality, somewhere around 20%. with excessive sitting. So that's over and apart from your activity levels. This is another study I'm going to go through. This is a prospective study. It was actually from the National Cancer Institute study. It was a meta-analysis of 6 studies. I had never heard of this journal, but it's PLOS. That's Public Library of Science Medicine in 2012. It's actually supposed to be a very reputable journal, but I had never heard of it. So these patients were ages from 21 to 90. They were followed up for 10 years, 56% women. That's one of the problems with this is lots of Caucasians in this study. The median age was 61. The median physical activity was 8 METs per hour, 8 MET hours per week. So that's right at the minimum. That's about 150 minutes of leisure, moderate exercise. Walking was the largest contributor. This was adjusted for age, sex, smoking, alcohol, education, marriage status. Longevity benefits did not differ for gender, but did for educational level, race, smoking status. Actually, it varied for educational level, different from what you would think. People who were the more highly educated and never smoked actually had a lower longevity than people who happened to be smokers who had quit and then exercise, things like that. So you've seen this graph before that I had talked about. So this is a graph that you can peruse, and this is years of life gained as opposed to leisure time physical activity. And at least in this study, it was up to 4 years of life gained. And in general, that's good life gained. It's not life in an ICU for the last 3 months of your life, things like that. But not all studies have longevity benefits like this. Generally, they're in the range of, say, 2 to 5 years with recommended amounts of leisure time, physical activity. And I found this to be interesting. This was comparing people who were normal weight, overweight, obese, with a BMI, they call this obese class 1, BMI 30 to 35, and obese greater than 35. And the interesting things here, these are years of life lost, is that people who are overweight and normal weight, there really wasn't any much difference, and don't ask me why people who are overweight seem to do better than people who are normal weight. I don't know that. Yes, I would say the same thing. And any type of exercise that you do, this is 7.5 MET hours per week. That's the 150 minutes area. Any type of activity that you do, even if you do less than the amount that is recommended, you will have less years lost with activity. So these are pretty sobering kinds of things to look at, but that is what the studies show. And this was about 750,000 people followed for over 10 Any questions about that? So cancer. I mean, everyone thinks, well, activity is preventative of cardiovascular disease. But I didn't know this, but it's actually preventative for certain types of cancer. Multiple studies reviewed by this task force who wrote the scientific report for the physical activity guidelines reviewed multiple studies related to cancer, and there's a clear reduced risk of some very common cancers with increasing activity levels. And generally, the reduced risk range is in the 10 to 20% range. So this is from the scientific report, and this summary of physical activity and sedentary behavior with specific cancers. And you'll notice that the evidence grade for this is strong for some of these common cancers: breast cancer, colon cancer, very common cancer. So these are strong evidence. Moderate evidence for lung cancer. I didn't really know that lung cancer was the most common cancer in the country. And not much for us old guys with prostate cancer. So this was new information for me. So I'll switch topics just a little bit now. I was talking about activity. Now I'm going to talk a little bit about cardiorespiratory fitness. Now this is more exact than physical activity levels because you can actually measure this, but it has a better correlation with health outcomes, or the same type of correlations you saw before. But cardiorespiratory fitness has a large genetic component. It's estimated that about 50% of your fitness level is related to your genetic components because people are born with different muscle mass, different lung capacities, different body builds, things like that. All of those things relate to your fitness level. But the other 50% of your cardiorespiratory fitness relates to how much activity you put in to improve your cardiorespiratory fitness. So this is usually measured by treadmill testing or bicycle ergometer. There are numerous studies showing that higher cardiorespiratory fitness decreases all-cause mortality and cardiovascular mortality, not just ischemic heart disease, but also cancer. And it's a risk factor, really, just like hypertension, smoking, and obesity. People with low fitness levels have a much higher incidence of developing, dying early. And some organizations are using this now as an essential vital sign, just like hypertension. Kaiser Permanente, some other big health systems are actually estimating people's fitness level and recording that as part of their initial intake of patients. So this is a study way back from, I think, 1989. People who have low fitness, men, women, this was treadmill testing. And people who have high fitness have a lower adjusted death rate. So this has been known for a long time. And this is an interesting study. These were people who were followed up for 46 years. This is from Sweden. And these people had not treadmill, but they had bicycle ergometer tests back in the 1970s. And they were followed up for 46 years. And people who had the above upper limit of normal oxygen consumption, which means their greater fitness levels, they had a much lower incidence of early mortality over a long, long time period. And these were all men, though. This was men in their late 40s when they were first tested. And as that other set of slides showed you, the adjusted longevity gains were about 4.5 years in these patients who had above upper limit of normal oxygen consumption compared to those who were below lower limit of normal. So comparable to other studies, the other study that I showed you. So how does exercise improve health? Well, these are some of the postulations. It suppresses tumor growth in mice, improves endothelial function. You get formation of cardiac collaterals, reduces inflammation. It improves other cardiovascular and cancer risk factors, obesity, hypertension, diabetes mellitus. And it has anti-atherogenic effects. I don't want you to, the only reason I put this slide up is because I've been talking about heavy things like all-cause mortality. But if you don't want to believe in that, there's all kinds of other benefits for increasing your activity level. Probably the biggest one is that it improves cognition and reduces the risk of dementia. And this is probably the single best thing that this country could do to reduce the risk of Alzheimer's disease, would be improving the activity levels of the general population. So I know that it sounds like increasing activity or increasing exercise is the magic pill, but this is a bitter pill for a lot of people. So how little can I do? Well, sitting is bad for you, standing is better. The minimum recommended is 150 minutes of moderate or 75 minutes of vigorous, or 7.5 to 15 MET hours per week of activity. Less than that is very helpful. You don't have to exercise that much. And actually, it used to be from the 2008 guidelines, it was recommended that you do 30 minutes per day. It sort of said you should have a time period that was done. But now studies have indicated that it's not that you do the exercise in a definite time period, but it's what you accumulate, even in 5 or 10 minute bouts of increasing activity levels during the day. I know people have read about this, but walking from your car to from the parking lot into the building, walking up the steps, doing little things throughout the day adds up to increasing your activity level. The studies have shown that weekend warriors who only exercise twice per week, people who jog only 5 to 10 minutes per day, you get tremendous amounts of benefit from that and definite decrease in your all-cause mortality from even less than the recommended amounts of activity. Walking is the most common activity. Step counters are helpful. There's these accelerometers, which I don't understand, but they're going to be coming around. Does anybody, you have to be pretty old to remember this guy, do you? People remember, does somebody remember this guy? Do you? All right. Actually, I did run when I was younger, and this is the man who popularized the running craze, and he died running at age 52. He also happened to have had a total cholesterol level of 250. He had, on his autopsy, he had 3-vessel coronary disease. And he took up running when his father died at age 42 of a massive heart attack. He lost 50 pounds when he was 37, and that's when he started taking up running. But he figured that running was just going to take care of everything for him, and it didn't. So your other risk factors do count. So can there be too much of a good thing? If there are any marathon or ultramarathon runners, cross-country skiers, cyclists, Tour de France type cyclists, this would apply to you. The CT coronary calcium scores are increased in some ultra-endurance athletes. It's well documented that there's an increase in arrhythmias, especially atrial fib, in some ultra-endurance athletes. Some of them have shown evidence of myocardial fibrosis. It's documented that up to 50% of people after a marathon will have elevated troponin levels for a couple of days. And it's also documented that people can have post-exercise cardiac dysfunction, and there's a postulation that there could be such a thing as cardiac fatigue. You're hurting your heart muscle by exercising too much. That's a postulate. This is not a proven thing. This is actually the National Cancer Institute study, again, taken out to more years and more patients. The median follow-up was 14.2 years. This is in this article I have in the reference. Compared to no activity, you have a 20% lower risk at the minimum, 31% at 1 to 2 times recommended, 37%, 39% at 3 to 5 times. Let me just show the slide, that'll be easier. So for people who don't exercise at all, if you exercise some, even less than the recommended amount, your drop in all-cause mortality is about 20%. People who exercise the recommended amount, the drop in the mortality is about 30%. If you exercise 2 to 3 times the recommended amount, the drop in your mortality can be up to 39%. But actually they followed, I don't know where they found these people who exercise this much, but they followed some people, and you don't get any improvement with exercising to at least in all-cause mortality. Yes, you can improve your blood pressure, keep your weight under control, all kinds of other good things, but you don't get any real improvement in all-cause mortality. But they do see this little bump here. When you get to 10 times the recommended amount of activity, that out here at 75 met hours per week, that's something like 18 hours per week. So if any of you exercise that much, you might have to pay attention to this. But the confidence intervals were pretty high here. There were very few people out here, but there's a suggestion that if you exercise this much, you might have to. But this is just a conjecture. So in conclusion, these are all observational studies. They don't prove causation regarding longevity. I would have to point that out again. These are observational studies, but they are very compelling, and this has been shown for over 40 years, and there's a graded improvement with your exercise, with your activity levels. Sitting is bad, standing is better, more bang for your buck with a small amount of exercise versus large amounts. No definite proof that large amounts of exercise are harmful, and healthcare professionals need to advocate to people that inactivity is bad. It's just as strong a risk factor as hypertension, smoking, things like that. So that's overweight me, but overweight people, we're doing fine. That's my daughter, that's my son-in-law, and that's the mud run, and it's 2 weeks from now if you want to do the mud run. My 9th straight year of doing the mud run. And I have to end off with Winston Churchill. Those are references. I do have questions. I do have some questions. Any questions from the audience? Let me go through these questions. Increasing activity levels can reduce the incidence of the following cancers: breast, colon, prostate, all of the above, E and A and B above. E. That's right. The answer is E. Recommended activity for all adults is, this is a tricky question. It's actually D. 75 to 150 minutes of vigorous activity. That equates to 150 to 300 minutes of moderate activity per week. Adults who meet the recommended guidelines have reduced risk of all-cause mortality in the range of 10%, 30%, 20%. The answer is B. All right. Any questions? Yes.
Herb, thank you so much for that talk. We're really going to miss you. So when I see patients in clinic and I'm seeing an overweight child, and I point out that the child is overweight and probably somebody should do something about this, and then the mother says, oh, he eats very healthy and he exercises all the time, he plays outside. So as you were preparing this talk, did you come across literature that talked about effective motivators to get our patients to exercise, or do you have pearls of wisdom that you might be able to share regarding techniques that actually motivate patients to get exercise?
No. No, I don't. I've almost given up on weight control, but I do tell people that, whatever you do, please get out there and do something. It's funny, I've gotten all the consults over the years for obese teenagers with hypertension, and clearing them for sports, things like that. To me, it's unless your blood pressure is like 190 over 120, it's sort of like a no-brainer. You need to go play sports. It can only help. So.
For you to repeat this question, but in terms of you talked about the genetics is a huge factor. You didn't mention, or maybe you could kind of summarize what the current recommendations for the AAP are in terms of screening those kids for some of the hyperlipidemias. I think we kind of have, is it still 11 years of age or in?
Yeah, the screening guidelines are still around 11 years of age for screening total cholesterol. And I think, again, at 17 years of age.
If you have an early family history of early cardiac death, does it lower the age at all?
No. No.
11.
Right. Yes. Yes. Dr. Powell, yes.
In terms of obesity in our pediatric population, I was at a conference this spring with the state, which studies and they said that studies are showing with our youth that the average population study that people are only consuming about 100 extra calories a day over their needs, which doesn't sound like much except for think about, just use the mathematics of whatever, how many calories per pound, over the course of the year, that's about a 9-pound excessive weight gain, so over several years, that could translate into significant obesity. But when you say, footnote, you say health, we're just doing it for guidance with all of our, all comers in our clinic. Just things like cutting out sugary beverages, that 100 calories is the co-biggest, right? Cutting out sugary beverages and getting up and walking. You don't have to make a dramatic change to change the trajectory.
If people didn't hear the question, it was related to our teenagers with obesity who only take in an extra, not a whole lot per day, but it really adds up over a year's time, which is true. And I know pediatricians talk to their patients, their teenagers, a lot about diet, and I can't add a whole lot to that. That's actually a lot of what I tell. I never talk about diet. I say, don't ever smoke, don't drink soft drinks, stay away from hamburgers and French fries if you can. Eat more fruits and vegetables. What else can you say? Exercise.
Herb, did they talk about any kind of heart rate guidelines for moderate exercise? It's sort of hard to know what moderate exercise is.
It is hard to know what moderate exercise is. It's a bit, for people who are more fit, moderate exercise is actually more than it is for people who are less fit. But according to the guidelines, they go by the METs. So the metabolic equivalents. No, they didn't talk about heart rates as what. Well, they did talk about the breath test. Moderate exercise is if you can talk but you can't sing during the exercise. Vigorous activity exercise is if you can't talk during exercise for more than a few seconds. So.